I'm Corey Reed, physician assistant here at Broadway Clinic and Broadway Clinic FedCare. Just discussion today about what to do when a federal employee is injured. A federal employee really encompasses anybody that's under the Department of Labor umbrella. And that encompasses a wide variety of occupations, whether that be Tinker Air Force Base, the FAA, the United States Postal Service, FBI, anybody that falls under that umbrella of Department of Labor we see and treat here at Broadway Clinic FedCare. Treatment usually consists of an initial evaluation for the case. It's a much more involved process than just a normal injury evaluation. The Department of Labor requires very specific wording on paperwork, semantics, and everything that make it very difficult for just a regular physician's office to handle this. We've been doing this for 15 years plus. So we know exactly what they need in terms of that paperwork and those semantics. The typical federal employee that we see is usually one of a cumulative injury. We also see acute injuries, but the majority of what we get is cumulative injuries. If it's a postal carrier, you get a lot of cumulative injuries such as neck, back, degenerative stuff that is accelerated from their job occupations, carrying a heavy mail bag around up to 70 pounds, walking 15 miles a day. That's difficult on the ankles, it's difficult on the knees, it's difficult on the back. A lot of the things we see are repetitive motion injuries like carpal tunnel. Cubital tunnel, which is a very similar injury to carpal tunnel, except it's at the elbow or the ulnar aspect of the wrist. These are repetitive motion injuries that when these people are performing these jobs, they're more likely to suffer from. We do see acute injuries. One of the most common, especially for mail carriers, would be a dog bite. So we see dog bite injuries, that's very common. Others that they can be cut on mailboxes. They can have lacerations from the equipment at work. A lot of the majority of the serious injuries that we see can involve falls, delivering mail and they trip over, landscaping, and they can have neck and back injuries, head injuries, concussions. Those are a little bit more serious. It's a very specific type of care. So when you go to your regular primary care provider, they are not authorized to see you under the Department of Labor. There's also some confusion when it comes to the employer. A lot of times the employer wants you to go to a certain physician's office. However, the patient needs to understand that they do have a right to their own care, and we're honored to be able to provide that care for them. Once you come, you get evaluated. Everything is in-house. We have in-house x-ray, in-house pharmacy. We become basically your treating physician. If it's a significant injury where it needs MRIs or CAT scans, we will send you out for those. If you need a specialist to treat for those injuries, we will send you out to the specialist of whatever specialty it is, be it orthopedics, neurology, gastrointestinal, whatever the injury has to do with, we will get you to that specialist. When you come to us, we give you a history and physical. We will provide a report for you, and that report really is the key to getting your case accepted. It has to have the proper language, as I mentioned earlier in it. Once that case is accepted, then we are able to move forward with further care, whatever it may be. After you reach what we call maximum medical improvement, where you're basically as healthy as you're going to be, or you're healed as you're going to be without any further treatment initiated, then you will be eligible for what's called a scheduled award, where we will send you to a physician that we use, one of several that does a permanent impairment rating, which is basically a big book that has every injury, every body part under the sun under there. The injury is evaluated, and basically you're given a percentage, and that percentage equals to a dollar amount for a impairment rating or a scheduled award for the patient. Again, that's at the end of care after everything has been completed. That is one of the benefits of the Department of Labor program. It can be slow to get the paperwork started, but the end of it does have some benefits other than just getting you back to your normal occupational duties.